Everyone, this is Dr. Razi, and we are finishing the thyroid examination station. And as usual, first we spoke about the examination of the thyroid gland. The second session was about the examination of the thyroid status. After you finish these parts, because this is an examination station, they are going to ask you some questions, and there are few questions as the time is short and you need to be sure that you know the answers because there is no time, and this is an important part of the station. So the first question that will be asked to you is your differential diagnosis. Okay, and the differential diagnosis, now after finishing the examination of the thyroid and doing the status, if the question is not about only the neck, if it is about the thyroid in whole, your differential will be simply number one, it will be multinodular, simple multinodular goiter. Okay, your second differential diagnosis is going to be thyroiditis. Okay, and the third differential diagnosis is going to be thyroid neoplasm. Okay, so these are the three differential diagnoses that are requested from you in this station. The second question that will be asked to you here is how would you manage this patient? It's about management. Okay, so management of this type of swelling in the thyroid gland, it is similar to the situation in the breast. Okay, so number one, as usual, you are going to do history and examination. Okay, and examination. Number two, you are going to do some radiological studies, and in this case you are going to do an ultrasound scan. Okay, and thirdly, you are going to do tissue study. Okay, and in this case here you are going to do fine needle aspiration cytology. Remember that cytology is not used in breast. Okay, so this C is not available in breast mass, but in a thyroid mass you are going to do fine needle aspiration cytology. In the beginning you may need more, but this is the list of the management and the things that you are going to do in the beginning. This is known as the, as you know, the triple assessment, right? Okay, so let us go to the next question, which is the third question here. Okay, the third question is, you finish your management in the beginning. Okay, and you did also the thyroid function test. I will add this here. Okay, and they tell you that while you are doing your things, and after a while the patient came back with pain and pain on swallowing, difficulty in breathing, and that happened maybe a few months later after this visit. Okay, so they are going to ask you, does this event change the management or your plan or not? And the answer here is yes. Why? Because there are obstructive symptoms, right? So what is your management here? It is thyroidectomy. Okay, so in this case here, it is not important or necessarily that there is a tumor. If there are obstructive symptoms, you want to do thyroidectomy. The next question, fourth question, and the one before the last, is that they are going to ask you the fine needle aspiration, FNA, as cytology came to you as there are follicular cells. Okay, and this is a common traditional question, follicular cells. So the report will say that it is unable to differentiate carcinoma from adenoma, in this case, in the follicular case. So why do you think that? And the answer, as you know, that is follicular carcinomas are differentiated from follicular adenomas by biopsy. Okay, why? Because the cells are similar. The only difference between follicular carcinoma and follicular adenoma, okay, is that the carcinoma will penetrate the capsule. Fine. So this is the capsule. It will penetrate outside. So you have to take a biopsy in this case. The whole gland or a part of the gland will be taken with the wall or with the capsule, and in this case you will know if it is invaded or not. If it is invaded, this is cancer. If it is not, this is adenoma. Well, the last question here, they are going to ask you, well, this patient now has a cancer. So what is your management in this case? So there are some steps that you are going to do, and the steps will be as follows. I will make him here for you that you will remember them. Okay, this for this question. So first of all, and you want to say this because it is important, this case will be discussed in a multidisciplinary team, the first thing. Okay, and you are going to do a workup for total or hemithyroidectomy. Actually, there is nothing total. There is subtotal all the time. If you say total, it will be understood as subtotal because nobody can remove the whole thyroid gland. There will be cells that are remaining there. So total or subtotal. Subtotal is more specific. Okay, so subtotal or hemithyroidectomy. This is the workup. So you are going to do your workup, preparing for subtotal or hemithyroidectomy in case that this is confined to one part of the gland. Fine. And they may ask you what is the survival rate of follicular carcinoma. This is the sixth question, and the survival rate for follicular carcinoma is more than 90%. Okay, so in this way we are finishing the thyroid examination station, and I hope you good luck. It is a good station, and it is easy to pass. So see you in another station. Thank you very much.